Hello, my name is Frida Batamuci. I am an Black American woman. I have dreadlocks. I am wearing a multicolored dress with blues and oranges and grays. And I have Post-its in the background because it's the only way for me to stay organized. And I am the programmer for the Athena Film Festival. On behalf of Barnard College and Women in Hollywood, it is my honor to welcome you to the 11th annual Athena Film Festival. This festival is dedicated to celebrating the stories of bold, courageous women leaders and the filmmakers who bring these stories to life. Thank you for joining us. This year's festival would not be possible without the support of our dedicated sponsors. Please join me in thanking Athena's founding sponsor, the Artemis Rising Foundation, and its CEO and founder, Regina K. Scully, whose visionary leadership makes our work possible. A special thank you as well to our premier level sponsor, the Alfred P. Sloan Foundation, which shares our commitment to showcasing stories of women in science. To all of our sponsors, whose names you will see before each film and event, thank you for your commitment to challenging our culture to be more inclusive and inspiring audiences in the process. This year, we wanted to create something new and exciting to bring to our audience. So we are programming 8 different program areas that we believe react to and respond to our current moment. This conversation is part of our A Look at Health program area. In this area, we dive into questions of how we deal with the large sphere of health, physical health, mental health, community health, public health, socioeconomic health, every type of health you can think of, with a focus on the ongoing fights for reproductive rights, justice, and disparities in maternal health care. This panel, which is reframing the conversation on reproductive health, is an important part of our A Look at Health program. I'm very pleased to welcome Raj, who will be moderating this conversation and will introduce our panelists.
Hi, everyone. I'm so happy to be here. I am Raj Punjabi. I am a brown-skinned Indian American woman with a apprehensive smile because I'm excited to be here, but it's still a pandemic. And then I have a white and blue background. I am a senior editor at Mike.com, a culture and politics and health journalism site. And I have been a health journalist for 10 years. I'm so excited to be talking to these lovely humans about how we are going to reframe the conversation on reproductive health together. And I would love for you wonderful people to introduce yourselves so you can talk a little bit about the monumental things you've been doing in the field. Let's start with Nubia, if you will.
Sure. Greetings, everybody. My name is Nubia Earth Martin. I am a Black woman of African descent. I'm here in my home office. Colors in the backgrounds are purple, and I like my shirt. I have on a multicolored head wrap and colorful beads. I am the president and founder of Birth from the Earth, Inc., which is a nonprofit organization based in Yonkers, New York. We are steeped in education and empowerment and creating access to equitable, safe care regarding preconception health, pregnancy, postpartum, and just well woman care. Super excited to be here and be part of this conversation.
Awesome. Thank you so much. Becca?
Hi, my name is Becca Asaki. I'm a Japanese American woman with glasses and short black hair. I have some pictures in the background along with a red sign that says "Not Your Model Minority" to match my red nap-off shirt. I am the New York City organizer for NAPOF, the National Asian Pacific American Women's Forum. And we are an organization that works to build the collective power of API women and girls to gain full agency over our lives, our families, and communities, using a reproductive justice framework, and particularly focusing on the intersections of immigrant justice, economic justice, and reproductive health. And I use she and they pronouns.
Thank you, Becca. Lila?
Hi, my name is Lila Meadowconner. I am also an Indian American woman with a mom bun right now currently, and a black shirt and a white background with lots of words around me. Notes actually on my wall. I am the founder of Mama Film, which is a nonprofit organization based in Wichita, Kansas, but presenting content around the world. And we present content, produce and present content through a maternal and feminist gaze. And in 2020, founded the Repro Film Festival, which is dedicated to reproductive justice and healthcare for women and women identifying folks, and through presenting film and lots of conversations.
Very cool. And Liz?
Hi, I'm Liz Ananat. I'm a white woman with brown hair pulled back and glasses, and I'm wearing a blue cardigan. In my background is a bureau with some art objects on it that were made by my 9-year-old. And I am an economist. I'm a professor at Barnard College, and I study poverty and inequality in the United States with a focus on reproductive health and the ways that women's access to choices to determine their own reproductive lives affect their futures in many ways and their families.
Awesome. Thank you. I want to thank you all for being here. I just want to say that the work that each of you are doing in your own fields is incredible, so inspiring, and you are my celebrities. So please forgive me if I accidentally call you Beyonce. But I'm gonna spread out the questions because I want to know about each of your work and what you feel about how we need to reframe conversations about reproductive health and rights. So I would love to start with Becca, if that's okay. I want to ask, and feel free, anybody can chime into these, but I've looked into all of your work and I'm really excited to dig in. As an organizer, primarily that's your work, regardless of what capacity it's at. As an organizer, what do you feel in 2021 is the most powerful way to be an advocate for women's health and gender non-binary people's health?
Thanks so much, Raj. That's a great question. One that I think we are still trying to figure out the answer to. There's a lot that's changing every day in this pandemic that we are living in. One of the things that I think is unique and useful about the organizing work that we do is, because we use the reproductive justice framework, we really are thinking a lot about intersectionality, right? So our experiences as API women, trans, or non-binary folks is not one-dimensional. And therefore our health and our lives are affected by the various parts of our lives. So when we organize from those intersections of our identities, we actually can organize around solutions that are rooted in the realities of our lived experiences. And I'll just speak maybe a little bit about some of the work that we're doing right now. So in the pandemic, we noticed that there was a lot of ways that our community was being particularly affected by COVID and the economic fallout. And so we, a lot of API women, for example, work in service industries, restaurants, nail salons, domestic work, lost a lot of work and have been out of work for a long time. This really affects our not just our ability to put food on the table. It affects our health. It affects our ability to stay in our homes. So we really, started, as an organizing principle, you start with, asking questions, right? Like, what is going on with you right now? What is the thing that's most affecting you right now? How does your identities intersect with or affect your ability to, live the life that you want to live, right? To have the power to parent the way that you want to parent, to, have autonomy over your bodies, your families, your communities. And that's been a really key issue for us as a way to identify what it is that folks want to organize around. So, we've had a lot of surveys, community, in different languages, about 6 different languages. We had community meetings, also in different languages to identify with folks, like what is the most pressing of the many, many issues that are affecting our lives right now. And, you know, a lot of it had to do with being able to have access to any of the supports that are theoretically out there for our communities, but we can't actually access them, right? Because, you know, maybe we don't speak English proficiently or as our primary language. Maybe no one has ever actually reached out to our communities before because we are a low incidence language group. So, you know, for example, we held a meeting in Burmese and folks were like, no one's ever held a meeting in Burmese to ask us what was up, to ask us what we were experiencing and feeling and what support we needed. And so, you know, that just holding that one meeting, you know, because we had a member who spoke Burmese and really wanted to make sure that her community was being heard, was really important and remains really important. And we know that that's just one example, one experience among a lot of folks who, you know, are really facing quite a bit in this moment.
Sure, absolutely. And I want to invite you guys to contribute to this question, but I want to add one more to it so we can all talk about advocating. Becca mentioned frequently accessibility and disparities. Like these are things that we're dealing with, right? The haves and the have-nots. So I just want to put this out there because all of you do very different things and are still working toward the same goal. I'm going to give you $1 billion budget for 2021. Okay, I'm giving you $1 billion. Where are you putting it in a way that advocates for reproductive health, women and gender non-binary people's health? This is your money. Where do you think it needs to go?
Yeah, I'd love to jump in on that. So the majority of my work is about making sure the maternal mortality and morbidity rate disparities that we've been experiencing continue to improve, because we know that the rates overall are improving, but for Black women and women of color, they continue to rise. So I would definitely be using those funds to make sure that everybody has access to equitable care, and making sure that the care that they're receiving is one in which they're an integral part of their own care. You know, especially with midwifery, the word means with women, and you can show up many different ways for the families that you're serving. So sometimes it's just about education for options on where and how you birth, whom you receive your prenatal care with. And I think what the pandemic kind of did was amplify all of the things that we were already experiencing. And many people were suddenly interested in out-of-hospital birth. And what I found interesting was the evidence shows that for people who are experiencing a healthy, low-risk pregnancy, out-of-hospital is the safest space. And about 85% of pregnancies are considered low risk. However, 98% were happening in the hospital. So the pandemic kind of, you know, flipped that on its head, because now people were, you know, worried about having a newborn in a hospital where they might be exposed to COVID, or were worried about not having their partner or family members or labor support being, you know, allowed to come into the hospital to help them. So we're really trying to make sure that if somebody would like to birth outside of a hospital, they know the places in their community that allow for that. They know the birthing centers, they know what insurance they accept, they know which home birth midwives serve their community. So I would really use it to make sure that, you know, the same way we know where we want to eat, and like, you know, Grubhub and all of, you know, Yelp and all of these things, right? That for something as important as our health, we understand what, you know, what things are available to us, and we're really framing it on what's important for us. What values do we really want to see in the care that we get, and where and how we welcome, you know, our babies into the world. So I think that's where I would put the funds. And one of the things that we worked on right before the pandemic happened was an access to home birth scholarship fund. So that when insurance will not cover the full amount of out-of-hospital, you know, birth, families can apply for assistance to cover the cost for the midwife. As soon as the pandemic hit, so many more families were interested in obtaining those services. And our initial goal was to help one family per month from March of 2020 until December. And we actually ended up helping 21 families from March of last year to date. And would love to kind of keep that going until the insurance companies catch up and are covering home birth, you know, the same way that they cover hospital birth.
Yeah.
That's really incredible. Both the work that Becca is doing and the work that Nubia is doing, and I'm sure so many other nonprofit organizations. If I had that money, coming from a media background, I would find a way to tell these stories on screen and to share them with a bigger audience, and not just a microcosm of people who are interested in documentaries or interested in this subject. There needs to be a way to make these stories more accessible, I think, and so that people understand that it really does affect them. I think a lot of people have this misconception that that's not for me, or that content is not for me, but really it is for everybody, and everybody needs to know the humanity around them. And so personally, that's what I would do. I think film is such an accessible medium and art form for so many people, and if we can use it in a better way and not just in a Marvel kind of a way to to educate and connect our world, we'd be in such a better place.
Right. I just
Agree.
wanted to say, especially now that we're all home, right? Like we're home more. So you want the content that you're looking at to have meaning behind it. And what a great platform to use to really reach the masses. I think that's incredible because, yes, everybody needs to be part of the conversation and understand how they fit into, equitable healthcare. Yeah.
Yeah. So with $1 billion, I would take over the Netflix algorithm. How about that?
I would welcome it.
Sorry, Liz, you can go for it. I'll jump in after you.
And I think this builds off of a lot of responses that you all have given. I think I would, but it also reflects, my background as a researcher. So we've been doing during the prior to the pandemic and then during the pandemic, daily text surveys with 1,000 low-wage hourly service working parents of young children in the city of Philadelphia, trying to understand every day what their day looks like, trying to balance work in these frontline industries, trying to balance remote school, trying to make ends meet with a lot of, like you talked about, Becca, loss of work during COVID, trying to access programs that are are designed with these very middle class models of what kinds of ways people access programs. And then, of course, the people who need these programs most often don't have the reliable internet. They often don't, weren't given all the paperwork by their employers or their landlords that they were supposed to be given, et cetera. And I think, we see these national conversations around the policies that people need to get through COVID and to rebuild in a better way after COVID, and they generally are not centering the voices of the people who are the most affected, right? We've seen this for so long, right? Policy debates about access to reproductive health, access to birth control, access to support for families, being done by a bunch of white men in suits, right? We see it now, people talking about, well, should schools be open or closed? And almost no one, and talking about, well, this is what's, worse for racial health disparities. This is what's worse for educational disparities. And the experts on what is best for children is often the individual parents of these children, and we're almost never asking, these parents, like, how is this working for you, and how could we make it work better? So what I would love to see, with that much money is that sort of WPA style, when they sent researchers out to communities where people had never asked, what does your life look like? Tell us your story, and document for people who speak all of the languages that Becca was talking about, right? Document for all of these different communities across the country. What is the life of a parent? What is the life of someone who's hoping to become a parent? How can we support them in building the life that they want from their perspective? And with $1 billion, you could do that on a really large scale and get the kind of information to make policies that actually translate into something that makes sense, in people's lived lives.
Mm-hmm. I think that makes a lot of sense. I feel like a lot of decisions and policies are created from a deeply uninformed place.
Yeah. Yeah, I could just jump in. I'm bursting at the seams, Raj, with this question. I'm so glad you asked. Because what came out of all these community conversations and surveys and reaching out to folks is We need investment in our communities. Folks were really, really not getting the support and services that we needed. And we know that a lot of API-led organizations that are maybe the only ones that speak that language or provide that service to that community were picking up the slack without a whole lot of support. And, I think as we looked into this more, and not just on the side of, our members and their families who themselves are helping their family members sign up for benefits or find out information about where to get tested or where to get food, where to get rent support, how to put together a will, these kinds of things where like there's just a lot of support needed. We also talked with a lot of other community organizations that are led by API folks that serve our communities. And we realized that we make up 15% of the New York City population, API folks, and we get less than 5% of the city budget. And, and at the same time, 1 in 4 API folks in New York City lives in poverty. So we actually have the highest poverty rate in the city, just, which I don't think that most people really know about. I don't know if we knew about that, except from our, experiences, but we didn't necessarily see it as, an overall issue. And, so I think that, putting money in the hands of our community members, of our community organizations, and I would be remiss if I didn't say, as an organizer, into organizing and building our power, as a community to demand the things that we actually need and deserve in our communities, right? So whether that is around rent relief or, canceling rent so that we can stay in our homes and be healthy, that we don't have to double or triple up in apartments, or to get healthcare to supplement the government healthcare that sometimes we can't access because we're immigrants and we don't qualify. To supplement the ways that our healthcare doesn't address all the things that we need, right? So we know federally funded healthcare like Medicaid does not cover abortion access, for example. So that leaves all these big gaps for our communities, and the ways that we know how to fix that is by organizing our communities, by demanding the things that we need, and having those things be rooted in what we identify for ourselves as most needed and what the solutions are going to be.
Yeah. So Barnard and the Athena Film Festival will be Venmoing you all $1 billion later today. So please enjoy the funds and do what you will with it. It sounds like you have good plans. My next one is for Lila, but again, would love to hear from all of you. A couple of years ago, there was a New York Times story by Linda Villarosa about the maternal mortality rate for Black women, that she took a study and put faces to it and names to it, and she blew open this unbelievable reality happening in this country that I knew was happening, but once a story is told, you become invested, and we needed to be invested in this story. And I want to ask Lila, who is facilitating all of these stories being told, can you tell us about one that particularly inspired you or made you feel very invested in opening up a new conversation about women's health?
Yeah, gosh, there are so many. And, one of the things I just want to start off by saying is I think that festivals like Athena are so important for this reason, because so many of these stories get told independently. And like we said before, they're stories that you'll see at your film festival, but, or maybe at an art house cinema, but there's not an accessibility, a broader accessibility to them. And I think that's something we really have to work on. At our festival, our first Repro festival last year, we showed a film called Belly of the Beast. And maybe some of you have seen this, but that, along with other films, there's just so many movies that are in my head. I'm sorry, trying to think of one in particular. There was also a movie about endometriosis, and sort of a random subject for a movie. It was called Endo What, and it was something that it was a movie that's about 6 years old, and I watched it and I thought, oh my gosh, I had no idea about all of these things. I had no idea that maybe I have endometriosis. Wow, this could explain so much. And so like thinking about, issues and finding ways to tell stories that are beyond politicizing them. Because we get so caught up in like the politics of it all. And, when people think about reproductive health care and reproductive justice, they automatically think about abortion. But it goes so far beyond that. There's so many other issues that women in particular have to face just because we have a uterus, and there's all these other things that, and so when you see these stories that like sort of go beyond that and you find them relatable, and you can start conversations with it. I passed that movie on to several friends and they were like, wow, like this is amazing. I had no idea that this could be something that's happening to me. So I feel like now I'm like kind of forgetting your original question because I'm kind of going off somewhere, but I do feel like, when we can bring people together around movies and around film and start these conversations, it's so important. And there's so much understanding and like knowledge and like this sort of ownership of your own health that somebody mentioned before that I think is so super important that we as women, I think we often disregard, or it does not become a priority for us, especially when there are children around you. And, it's not something that we ever allow ourselves to prioritize. And I think that's something that we have to be able to do.
Yeah, I wanted to say that I think, the research that Liz was talking about and the community that Becca's talking about and just the stories that Lila is talking about, what we're describing here is really a call and response, right? So it's, not just going into a community and saying, oh, this is what we think you need, but actually asking the people what they need. So we do a lot of quantitative, data and, numbers and stats and all of this, but we don't do nearly as much qualitative, data and really getting to the heart of what are people saying, is lacking, what would they like to see more of. And that's pretty much how all the work that I do has taken shape. It's based on the experiences that I had. I have 5 children. So my first 2 were born in a hospital setting. My last 3 were born at home with midwives. And it was the experiences with my first 2 that really shaped, okay, I wish I had this. There should have been community childbirth classes. There should have been a space that centered breastfeeding for Black women since we have the lowest initiation and duration rates. So all the things and the programs that we're putting out in the community are based on things that the community members and myself, wish that we actually had. And just thinking about, when we're talking about maternal disparities, especially here in New York, where Black women are dying 8 to 12 times more, that there's an actual family behind, each of these losses. There's now, a single father or, a child that is going to be raised without, a mother. So when we put a face to, these stories and actually give voice to people who are experiencing it, it does put it in a different perspective than just looking at, that 8 to 12 times more. One of the stories that really was a tipping point for me, and I'm not sure if everyone's familiar with Amber Rose Isaac, her story. She was a 26-year-old Black woman living in the Bronx here in New York, expecting her first baby due May of 2020, and was just experiencing, lack of adequate care, just negligence. And herself and her partner, Bruce McIntyre, reached out to me at Birth Mirror to find out, is it too late for us to have options to switch care? Our providers are not listening to us. And this did coincide with, the height of the pandemic. So when they reached out to me, it was April 2nd. And to determine if somebody is a good candidate for home birth, I have to look at your prenatal records to kind of see, is the pregnancy healthy? Are there any things that need to be addressed? And their complaint was she had not been feeling well, but was continued to be offered telehealth visits as opposed to an in-person visit. When I finally looked at her records when they sent them to me the next day, I realized that her platelet levels were extremely low, but had been low since December. So it wasn't so much that the pandemic was why this got neglected. It just had not been followed up properly since December. Long story short, I let them know that unfortunately with her platelet levels that low, she was not a good candidate for home birth, but more importantly, she needed to have an in-person visit with a provider like ASAP. And they were able to reach out to another branch of the hospital that they were going to get an in-person visit. And her care from that point on was just completely mismanaged. Instead of giving a blood transfusion, they decided to induce her labor 5 weeks early. The induction didn't work, as they often don't for a first-time mom, 5 weeks ahead of your due date. and they decided to do a C-section without doing any type of blood transfusion to get her platelet levels to where they should have been. And as soon as they cut into her, she died. When her partner reached out to say that she was no longer here, it was almost incomprehensible for me to understand. I'm like, what do you mean? Like, how she wasn't doing so, May, what happened? And I think it's those type of things, especially knowing them, even though, we had one consult, it wasn't like we had this long lasting, relationship. You don't imagine, that that's going to be the twist, that it takes. And it propelled him into action. We renamed our Access to Home Birth Scholarship in her honor. And I've been working very closely with him. He's been advocating to make sure that this doesn't happen to other families. So I think, we do need to hear these stories so that everybody knows we all have to take action. It's not just when it happens to you or when it happens to a friend. But, if there's any type of injustice in healthcare anywhere, then it could potentially affect all of us.
Wow, I'm so sorry to hear that. My next question is kind of is related, and I want to ask Liz, because as a teacher, as an educator, you do have the opportunity to be able to shake people up and get them to listen to things, to issues that aren't really publicized that much. And as a researcher, I'm sure you see really upsetting statistics, really upsetting case studies like the one Nubia is talking about. Like, this is a part of research as well, looking at individual things that happen to people that are tragedies based on the inaccessibility of healthcare. Liz, can you tell me a little bit about how you get people to listen when it's something that you see that's so alarming? And I want to hear the rest of you too, for sure. Like, there are things that deeply, deeply affect us, but it's hard for me to put them into words. How do you get people to listen to the things you're seeing?
I appreciate the question. I can't promise that I have a great answer, because I certainly wish we could get people to pay more attention than they do. I think around some of the issues Nubia is talking about in that, just heartbreaking story that also, sadly, it just at this point does not come as a surprise, right? You can be so heartbroken at the same time. I sort of knew where that story was going when you started it, because we've heard this story so many times. And how do we get people to pay attention? I think, sometimes the statistics and the data can help, because they can help disprove a lot of the myths that people have around how this happens. Some of the things I've seen people pay attention to are, there's a pretty clear graphic showing that maternal mortality declines with education for white women quite dramatically. And given the inequality of access to healthcare in our country based on finances, right? That we have a system where if you can't pay, you can't get good care. That sort of fits very much. The story of white women's maternal mortality fits very much with what people think. And then you show them the chart for Black women's mortality, and Black women's maternal mortality does not go down with education. If anything, it goes up a little bit. I mean, and people say, well, how can that be? And the answer, like, look at those pictures and tell me that this is not racism in this healthcare system. Tell me that there's anything that these women could possibly be doing to change how they're experiencing the healthcare system. And we're talking about people with PhDs. We're talking about people like Serena Williams, right? Cannot go into the healthcare system and have their own reports about their own bodies be taken seriously, right? When they are obviously the experts on this. And I think a lot of it is about getting our culture to respect women as experts about their own lives, and women of color and Black women as experts on their own lives and their own bodies and their own children. And I mean, I wish I had a great answer. I do often, when I'm teaching, I'll dig into the history and try to connect it and talk about the history of the dehumanization that is the root of anti-Blackness in our country, and the myths that were built up by these race scientists around, and that we see perpetuated in the healthcare system today, where we have medical students and doctors saying that they perceive Black people as experiencing less pain, and that Black people who are reporting pain can't be reporting it correctly. They must be seeking drugs, right? All of these just awful things, but we have the data. And so I will show those data to students and then try to connect it to all of these other policies we have that say things like, people of color don't need as much money to live off of because they can just get by with less because they don't suffer the way white people do. And the connection of that is really deeply embedded in our society, so that, and to try to get people to rethink the stereotypes that they've been taught. But I mean, I think it's really hard. I wish I had a silver bullet. I think showing the data and telling the stories is just more and more, and trying to, like Lila was saying, get at that Netflix algorithm and make people listen to these stories. It's really hard to look away from the stories, but once you've seen them, but I think a lot of people do try to avoid it because it's awfully painful.
Liz, that's actually a great answer, because I find that historical context is extremely crucial to understanding anything that's wrong today. Mm-hmm. But Nubia, I think you're going to say something.
Yeah, I was going to say the same thing. I think that's an excellent, answer. To understand how we got to where we are, we have to go, into the history. And I think we often don't want to do that because the history is not pretty, and, it's uncomfortable, and, it's kind of like, okay, we want to leave that there, but it perpetuates why we are, where we are right now. So going into the history and kind of, talking about the fact that Black women have never really had full autonomy over their bodies and their reproductive rights, and what that meant during the transatlantic slave trade, what that meant in terms of, at that time, there was a commodity for Black women to have, multiple children, and to perpetuate this idea of, yes, experiencing less pain, and they don't really suffer, and they can have, 10 children in rapid succession and continue to, survive. But it's like survive versus thriving, right? So we have been able to endure things, and I think that translates to some as, there's no suffering there. And what you were saying about the stats helping to demystify things and kind of dispel some of the ideas for why this is happening, that is really important. And I feel like now the conversation is shifting more to heart health. It's like, oh, well, heart health, if you look at the pie chart, heart health is the biggest thing. And it's like, yes, if you look at one, piece of it, it is the biggest number. However, the majority of all the other things are related to cesarean birth and the complications that come with that. So if you put all the complications for an operative birth together, it's a much bigger piece of the pie. But when they break it out into, sepsis, infection, pulmonary embolism, deep vein thrombosis, and it's smaller slices, and it looks like the heart health is the thing. So now the conversation that I'm hearing is, well, if they, work more on their heart health, and if, they eat better, and I'm like, well, if a 20-year-old or a 30-year-old is having a cardiomyopathy, right, they really haven't had enough lived experience to do that much damage to their heart. Let's talk about the heart chakra and the fact that there's deep-seated trauma that has never been properly addressed or given the space to heal from as a reason why, it's manifesting this way. So I think we have to make sure that we center just the holistic healing that needs to happen, and a space to, grieve the things that have gotten us to where we are, and having these conversations so that we're not saying, well, that was then, but no, it's still affecting now. And systemic racism and implicit bias is at the heart of this issue. And until we're going to actually face that head on and have these conversations, we're going to keep skirting the issue, and the numbers are going to continue to rise. And I always find that stat about college educated Black women are dying 5.2 times more. I'm like, what is that? If we're talking about 3 to 4 times more just in general, but college educated Black women, it makes me think, what are we trying to suppress? What do we not want, out there? So I think these are conversations that we have to delve deeper into, and we make ourselves a little uncomfortable, but to get to a place of deeper healing.
Yeah, and just to add, I love all of these answers, I really appreciate being in conversation with all of you. And, just to build off of what the two of you have been saying about, looking at our histories and also Nubia, what you were saying as far as like being in community with one another, right? Like these conversations are really important to understand where things are similar or dissimilar, right? Like what are the things that our each individual communities are experiencing? And also what things are similar, where is there a shared history, for example? And just to, we are a reproductive justice organization, right? Black women founded the reproductive justice movement, right? Like there is a lot that we owe to Black women, in developing this framework. And there are ways in which, our histories we can analyze. There's similarities, and then there's also very clear ways that we're targeted differently by things like racism and classism and all those intersections, but they also play off of each other, right? So just give an example. We have a national campaign around expanding health insurance access for immigrant women and children, and we are in this coalition with a number of other women of color, people of color led organizations. Because we understand there's unfortunately a very shared history of, sterilization in the Black community, the Asian community, the Latinx community, like all of us have been targeted with this. But as it pertains to this particular campaign, the 96 immigration laws that put all of these restrictions on our, especially our communities, but all immigrant communities, as far as, being able to access benefits, was the same time that welfare reform was being passed, right? That was demonizing and targeting Black women around accessing, public benefits. And so, restrictions on our immigration, statuses and our ability to access these benefits were coupled with the demonization of public benefits to begin with. And to be able to understand and, that had to do with the racism that targeted in particular Black women, and then also had this effect on immigrants as well. And that we have to, dismantle anti-Black racism if we're also going to, gain and win the things that we need for our communities as well. And just to throw back to your $1 billion, for example, there in New York City last year, there was a big effort to, remove $1 billion from the NYPD budget, $6 billion, right? And what were folks pushing for was investment in our communities, investment in, the things that we need there. You started this line of questioning with there's a maternal mortality crisis among Black women, like 8 to 12%. That's bananas. There is no reason on earth that Black women should be dying in childbirth, especially in a country like the US, especially in a place like New York. Like, what the heck is going on? And, clearly we have the money to be able to give, and to fund, things like the police department, but we're claiming we don't have the funding to support the, maternal mortality, ending maternal mortality in the city and in the state. Like, that's ridiculous.
I just want to add too that just jumping again on the point of history and how important it is, and like you've all spoken about, and I think that's where film can be a real, move things, advance things. The conversation. And I think that one thing that we forget about is what people think of history is often still happening. And so I don't know how we relate those two concepts, but like you mentioned, illegal sterilization, and that's a conversation that we know that it's happened in the past, but this movie I mentioned, Belly of the Beast, was about illegal sterilization happening in California prisons in modern present day. And so people don't connect that those things are still happening. And so in my mind, and it starts at the very basic level and goes really all the way to the top, is that we need more women and people of color in these decision-making roles just throughout like in every aspect of the world, basically, to understand and be more representative of who we are as a people.
Totally agree. And I just want to pull out something Nubia said that's related to this about what are we suppressing here? And I had a question down that kind of relates. When we ask what we're suppressing, a lot of these, everything from forced sterilization that's still happening to stigma surrounding reproductive health and things like that. What is it that you would tell a 10-year-old today and you would want to instill in this child about what you care about? I often ask, like, what would you tell your 10-year-old self? But really, I want to know what you would instill in a 10-year-old today, a 10-year-old girl, or, actually boys need to know about this stuff too. And, whatever gender they identify with at 10. But what do you want children to know before they get totally brainwashed by women hating society?
I think we need to, just think about, instead of, I think we talk a lot about, just sex ed, right? And people have this whole connotation behind that of, oh, you're going to tell kids about, and I'm like, well, no, it means age appropriate, conversations, obviously, with them about, anatomy and body autonomy, and also, yes, when they get to a certain age, like prior to puberty, like understanding what to expect about their body, but normalizing it. I think it's just been taught in such a way of don't do this and don't do that, but it's a normal part of our lives that we need to teach in a way that depending on what age they're at, they can grasp the concepts. I'm trying to think 10. What was I thinking? At 10, and trying to think. I have an 11-year-old right now, an 11-year-old son. But because of what I do, my children are very well versed, probably more than they want to be, about just anatomy and birth and all of these things. But I say to them all the time, well, I want you to know these things because one day, don't you want to be a parent? Like, don't you want to know, how to care for your baby, or where you yourself, or either your wife or whomever, where they want to welcome their baby? Don't you want to start thinking about those things? And for me, as a child, I was the one that was always like reading a book. My mom was not open to have those conversations, but I wanted that information, so I was always just reading things. I was the kid that would get off the bus and go to the young adult section in the library at 10, where I probably, shouldn't have been, not shouldn't have been reading those books, but I definitely wasn't checking them out because I didn't want them on my record. But I would, fold over the page and come back and read it. So instead of having to do that kind of in secrecy, I wish that we would have more of like an open, forum, that when kids are asking questions, I think that's the time, to have those conversations. And it might be different age depending on the child and their personality, but if they're asking and these are things that they're curious about, having the vocabulary to have that type of conversation with them that is age appropriate, but to not leave them in the dark, or leave them to seek that information, maybe not at the library in a book, but maybe from some place where they're not going to get factual information, and then it could be to the detriment of them. So I think just kind of normalizing that. And I know for a lot of parents that makes them sometimes uncomfortable because their parents didn't do it, but we have to break those cycles. At some point we have to say, okay, I wish my mom had done this, so I'm going to do this for my child.
That is such a fabulous answer, Nubia. I mean, everything you said is, I couldn't agree more. I have 2 daughters as well, and my older one is going to be 12 soon. And I think what you said about bodily autonomy is so important, and she needs to know that it's a basic human right, and she can decide what happens to her body, and she should always fight for that. And I do totally agree with you as well that it shouldn't just be young girls that we're teaching this to. It should be all children. And everyone needs to know this because, as you said, I mean, we may have grown up in a time where our parents weren't comfortable having these conversations. And honesty, exactly what you said about honesty and just being forthright and clear and not trying to make up cute names for things. Or, I mean, my mom tells stories about that. And I just think, oh, gosh, but we have a responsibility now to our children that they can then pass on to their children and so on and so on. So I think that you nailed it.
So, I agree. And as a parent of a 9-year-old to almost 10, something that I've said to her for years that I got from a friend with a similar age child who's a public health professional. We've always said, and this is sort of, I think, at any age sort of works, my body, my choice, right? And that's true under almost any circumstance, right? And so we always say it to her if she says someone else is doing, did this or that. Okay, well, it's your body, your choice. You say no if you don't like the way someone is touching you. We never did any forced tickling, right? Like any of that sort of, and also reflected that to her for others, right? Like, okay, but they said they didn't like that, and it's their body, their choice, and and that's true regardless of the identity of that other kid. I think partly, when I think back to the way I was raised at such a young age, I internalized that I was prey and that these other people were predators, right? And that I had to do all of these things always to sort of defend myself and to recognize that other people were going to infringe on me. And it was so disempowering, right? Because it wasn't like, no, you can just, like your body is yours. You are the expert on your body. You can always stand up for yourself. You have to take these evasive actions, right? And at the same time, not sort of learning that sexual trauma, that, all sorts of traumas are things that can happen to people of any identity, right? And they happen to boys and men, and particularly, boys of color, men of color in our society all the time. And, there isn't a group that is the prey and a group that is the predators, where we all deserve bodily autonomy and integrity, and we all deserve to be treated as the experts on our own bodies. And I think I do wish that more of my kids' classmates, boys especially, were taught, to respect my body, my choice, coming from other kids and coming from themselves as well, rather than sort of to the extent that I can dominate someone else's body, that makes me more powerful. That makes me, that makes me a man, right? Mm-hmm. That we all deserve our own bodies and no one else's is what I would really like kids of all gender identities and ages to be learning from the beginning.
I love what you said about mutual respect too, because that is so important.
Mm-hmm. Yeah, I love everyone's answers. They're so great. And I wish I had heard all of these things as a 10-year-old. Would have made a big difference. I think the only thing that I would add is that we are not experiencing any of these things on our own. I think that, a lot of the, our new members will kind of be like, oh my gosh, I can't believe that there's this group of Asian women, trans non-binary folks talking about reproductive health. I thought I was just the only person. I just never imagined that this group ever existed. And I think it, in particular in immigrant communities, but I think a lot of us are kind of trying to figure out a lot of this stuff on our own, because there's so much that's unsaid or not talked about. A number of folks remarked on, as we were trying to, engage in some intergenerational dialogues, that folks didn't know how to say abortion in their mother tongues, right? I just have no idea. I've never heard my parents ever say it, And at the same time, as we did have these conversations, we find that of course it's happening in our communities, it's happening in all communities, right? And not just abortions, but, birth trauma stories, or not being able to access healthcare or other benefits. And so, just because it isn't talked about doesn't mean that it's not happening. And that, in community, we can find the space to be able to, to bring these things to light a little bit more, to talk about them. And when we can talk about them, we can be more empowered individually and collectively to make big changes.
Thank you, guys. We just have a couple more minutes, and I've been wanting to ask you guys just about a phrase that has been circulated recently and has become almost trite, and it's dismantling the system, right? We all want to dismantle the system. I love that phrase. It feels very empowering to me. I want to get it tattooed on my neck. I just want to close up by asking you guys, and I want to make it a self-fulfilling prophecy. It could be something you're doing right now or something that you want to do in the future. Just in a line or two, how are you dismantling the system? And it doesn't have to be deep. You can just get the tattoo with me.
I think for myself, with my own personal midwifery journey, I realized that there are so many barriers to, midwives and student midwives of color. And I think part of dismantling the system is that we need to have more providers that look like the people that they're serving, right? And when there is intentional suppression behind more providers of color, specifically midwives of color, like right now, the profession is 95 to 97% white, right? So that leaves a very small margin for every other, ethnicity. That's part of the shakeup. So talking about like what qualifies somebody to be able to provide, certain type of care or support. Who are these, powers that be and accrediting bodies that sometimes serve as gatekeepers to people being able to provide what they know that their community needs. And then also encouraging people who do have, those credentials to give more. Don't just get, certified or licensed and then go work in a hospital and perpetuate the same things that you've been seeing, but step outside of that and maybe create, a midwifery program, for people who are having problems with the traditional, or I shouldn't say the traditional route, people who are having problems with the regular route of, entering these types of care. And that means going back to a more traditional way, because at one point it was, the grand midwives, the, Black midwives in the South who were birthing, Black babies, white babies, everybody's, babies. And then there was an intentional, suppression of them. And that, okay, well, now to provide this care, you have to have this type of education. Well, guess who couldn't get admitted to those schools at that time? Or you have to be, literate. Well, guess who just a few years before it was illegal for us to read and write. So, when you create these boundaries and barriers based on, again, systemic racism, right? We realize that if we're going to surpass that, then yes, we do need to kind of topple and rebuild back up. So that's what I'm personally doing, and making sure that people are aware that that is the route that we need to be collectively taking.
Thank you.
I totally want that tattoo as well. I think for me, it's really about like being able to, in some way, even if it's a small way, provide a platform for these stories to be told, and for work, for these conversations, and to hear the stories and the work that Becca and Nubia are doing, and so many other amazing organizers. We need to share these stories, and we need to come together and connect around them. And I think for me, it's being part of that. It's providing the platform, but it's also participating in these conversations and being in conversation with you all. Every time I come out of it, I feel like I have gained so much more knowledge and things that I didn't know about before. And I feel like it's really all about educating yourself about what's happening around you.
I think, reflecting on my position as a professor and the role that universities play in our country, which is in many ways a really powerful role, and views itself as a very progressive set of institutions, but often, is not, often really re-entrenches and reproduces the hierarchies from generation to generation. And I think, as a professor to think about how can I disrupt that, how can we disrupt that by who we bring in as students, by who we bring in as professors, but also by what we teach, and dismantling the curriculum of who we read, of the frameworks that we use. I mean, particularly in something like economics, what is valued and what is not, what types of labor are valued, what types of credentials are valued, and then, using that in research to amplify, because we do have a big platform, to amplify the voices, not of, you know, the other people who are in universities or the other people who are always heard, but to amplify the voices of people who have not had access to these institutions, and center that as a form of knowledge, as, you know, as the most essential form of knowledge, is how I think I would love to see universities viewing themselves. And I'm a little scared of needles, but I think I could get the tattoo with you.
Dismantle the curriculum. That's yours. Yeah.
That's a good one. I like it.
And Becca?
Yeah, I love this question. You know, my first thought was which system / all of them, right? So I think, you know, there's so much that I think unfortunately needs to be dismantled because it doesn't serve us in the ways that we need them to. But, you know, I think about, you know, dismantling you know, an economic system that profits off of the labor of, you know, immigrant women, poor women, and leaves us without social safety nets, you know, and that really we will achieve, you know, reproductive justice when we all have, you know, the economic, social, political power to really be able to make the decisions regarding our bodies, our families, our whole communities, you know, and when we, you know, I think there's also ways to, you know, dismantle the barriers in between our communities, within our communities, you know, around whose voices are the most important, whose voices are, you know, heard, and how do we stand up, you know, with and for each other, you know, to shift the system that we live in, that isn't meeting our needs. So I'm down to get the tattoo with all y'all and organize the rally to tear it all down.
We're all walking away with $1 billion of the police's money and a new tattoo. So this is like a really big
best panel ever.
I want to offer my intense gratitude to you guys for being here and for everybody watching. I know that everybody who cares about this stuff is tired at the end of the day. That's the one thing that unifies us all, because we're putting so much energy into this. Know that you all are leaving a legacy that's so important to all of us. We all are. So I just want to say thank you so much for that, and Godspeed, and let's do this.
Thank you so much, Raj.
Thank you.